Hi, I'm Paul Wright. Welcome to this presentation of rehabilitation, core conditioning and personal training using the Swiss ball. A couple of words of warning. This presentation is not meant to replace individual exercise prescription. If you have specific medical conditions, please see your physiotherapist or sports physician before continuing any of the exercises in this program. If you have any pain during the exercises, please stop and see your professional as well. I hope you enjoy the presentation. So why use a Swiss ball? They've been around in physiotherapy for many, many years. I know I've been using them personally for over 10 years now, and they've been around a lot longer than that. The general benefit of a Swiss ball compared to conventional exercise programs is the unstable nature of the equipment. It provides, when you're sitting on it, lying on it, or whatever you're doing on it, it makes a lot of muscles work a lot harder than they normally would. This increased neural activation is excellent as a rehabilitation tool and really good in a personal training or gym setting. The last 5 to 10 years has seen a big amount of research done on core stability and what it all means. Really what we're talking about is stability through the midsection, how well you can stabilise the base of your body while your limbs are moving in space. Before I go into that though, be aware that you're only as good as your weakest link, which means if I'm in a standing position, I may have excellent core stability through my midsection here, but if my hip is unstable, or my knee is unstable, or my ankle is unstable, that makes me inherently prone to injury. So whilst core stability is important, it's not the be-all and end-all. It's important that the whole mechanism is looked at as a stable entity, not just how well you are held together through the midsection. Something that's not done too much on the Swiss ball is stretching, and we find it's a really useful tool for stretching. So the next section we'll talk about is the stretches you can do on the ball. We'll start out from the seated position. So once we've mastered that position, we're going to do some seated stretches. Justin's going to firstly do a hamstring stretch. He'll do a single leg first. Yep. From there, he's dorsiflexed the foot. Now the key with the hamstring stretch, make sure you keep your lumbar curve. He'll then slowly stretch forward until he feels a nice pull through his hamstring. Nice little stretching exercise for the hamstring. Now we'll try a little neural stretch. We've done this one a little bit with our physio patients, some people that have really tight nerve structures through the back. He drops into this position, so it's a 2-leg hamstring stretch. He'll then slightly rock the ball forward and then slowly extend the knees. That's it, he'll bend and straighten. Now be very careful of this with people obviously that have back problems, but as a physio we find this a really nice stretch for mobilising those tight sciatic nerves. Our next section is focusing on spinal mobility exercises. Now as a clinical physiotherapist we see a multitude of people with stiff back conditions. The old adage, if you don't use it you lose it, is evident every day in our clinical practice. We see people that spend all day sitting, they're always there in that round back position, they're at computers, they're failing to mobilise their back. If you don't use it, it's getting stiff, therefore we spend a lot of our time trying to loosen up stiff backs. I found the Swiss ball is an excellent way of getting people to start loosening up those stiff segments of their spine, and today I'll show you a few of those exercises. The next exercise, he's going to do a supine hip extension with knee flexion. He's going to start out exactly as he did a second ago with 2 legs. He'll push down through his heels, lift his pelvis up off the floor, and then progressively curl the ball towards his bottom. That's it. He then extends it out again, and then drops the hips down. That's it. Curls in. Now again, same thing applies here. We're still trying to make sure we're stable through the midsection. Again, that setting core control we talked about. We're just expanding the stability point from just here, moving it around everything else that happens around that core position. Now again, obviously the advanced version of that is single-legged. I won't make Justin bring his hands in, I'm being kind at the moment. But again, it depends how advanced and how stable you are. As I said, the beauty of the Swiss ball is you get the chance to decrease or increase your stability as you need to. From there, with 2 balls, he drops down into the support position. Again, sets his midsection, he's starting on the knees, he takes both arms, rolls them forward, then he'll roll them back towards him. Really nice lower trapezius stability exercise. Now you're coordinating this trapezius, multifidus transverse abdominals. That's the 2-arm version of the Spider-Man. He can do an alternate arm. He'll bring one arm back and then swap it for the other side. Good exercise. Now to increase the intensity of the exercise, you'd obviously, if you were up to it, you'd slowly move your hips further forward, as Justin's doing at the moment, which again increases the intensity of the exercise by increasing the lever arm. Grab it right around your chest, Justin. Now from there, really nice for sports conditioners, I can come in and I'll try and take the ball away from Justin. Now he has to control and stabilise. Give me the ball, Justin. Sorry, the microphone. So you're just basically wrestling for the ball, and when you do it, you have to really control and stabilise as you do it. Footballers love those sort of things. You get them into a park situation, grabbing hold, and again, it becomes a challenge. They love competition. It's a great way to do it. Your personal trainer clients are like that as well. The idea as he squats down, he lets his bottom curve underneath the ball. So as he squats down, the bottom curves underneath the ball and pushes up, squeezing the gluteals and together at the top. That's it. Let the ball drop underneath, the bottom drop underneath, and squeeze up. Now this is one of these nice patellofemoral rehab exercises as well. You can put a medicine ball between the knees to squeeze in to add the VMO contraction in, as we talked about before, or the belt around the knees to push out to include a bit more gluteus medius. But again, depends on what problem you're dealing with here at the moment. That's it. And a nice progression from both of those is to grab the ball and then do a travelling lunge with rotation. So he'll hold onto the ball. That's it. From there, he'll step, lunge, and rotate. So we've taken away the stability of the ball. That's it. Or the stability of the wall, relying on him now to stabilise totally as he does a travelling exercise. He'll take the cable from here. He'll then take the cable and pull it across, diagonally across his body. As I said, quite easy done with a set of cables and a weight stack. Very, very nice exercise, incorporating instability from the bottom end now compared to the standing exercise.